If you've ever studied for hours in nursing school, still walked out of an exam thinking, what just happened? This episode is for you. Hi, I'm Dr. Godfrey, a registered nurse and nursing educator with over 20 years of experience teaching future nurses. Welcome to OB Clarity, where we break down complex nursing concepts so they finally make sense. You read the textbook, you attend lecture, you review your notes, and yet the exam questions still feel confusing. Some students even think, maybe I'm just not cut out for this. But what if the difficulty of nursing school is actually intentional? Today we'll explore why nursing school feels so hard and why that struggle may actually be shaping you into a safer, stronger nurse. That's what we want to talk about today, because that's what matters the most. Why does nursing school feel different? Well, most traditional college courses reward memorization. You memorize definitions, lists, or formulas, and these are courses you've taken before you even enter nursing school, right? Then you repeat them on an exam. That's normal. But nursing school is different. Nursing exams often give a scenario, and you guys know what's coming. A patient suddenly develops shortness of breath. What is the priority nursing action? All four answers might look correct, but guess what? The exam isn't asking, do you remember the information? No, it's asking, can you think like a nurse? That shift from memorization to clinical decision making is what makes nursing school feel so challenging. And I understand, guys, that it can be challenging, but you can overcome it. Memorization answers, what is the information? Clinical reasoning answers, what is happening with this patient? What's the most urgent problem? What could harm the patient if I choose the wrong answer? Or the wrong action? What should the nurse do first? So, clinical reasoning requires connecting physiology, assessment findings, patient safety, prioritization. This is a whole new way of thinking. And guess what? It takes time to develop. It's not overnight, and we understand that. I had a student, excellent in clinical, noticed subtle changes and asked great questions, but he kept failing exams. What was the solution? For him, it was concept maps. He mapped connections between disease processes, symptoms, interventions, possible complications. But once he saw the connections, exams made sense. He didn't become smarter all of a sudden. He learned to study in a way that supports clinical reasoning. And that's the key. That's exactly what we want for you guys. I had another student discovered she was a kinesthetic learner, right? She read her notes, she highlighted, that didn't work. But when she rewrote her notes by hand, reorganized the material herself, it finally stuck. So once again, it wasn't intelligence, it was finding how her brain learns best. Many interpret struggle as proof that they don't belong. But often it means your brain is learning a new way of thinking. You're not just learning facts. You're learning to make decisions. And these decisions affect real lives. This thinking develops gradually, and it develops through practice and reflection. So becoming a nurse is more than academics. I want to say that again. Becoming a nurse is more than academics. You're learning to notice the subtle changes. You're learning to anticipate complications, prioritize care under pressure, protect patient safety. Difficulty doesn't mean failure. It may mean you're becoming the nurse patients need. And that's what I want from each of you. Students who thrive stop asking, why is this so hard? You know what they ask? What is this question teaching me about patient safety? When you approach an exam and you approach those exam questions like this, they stop feeling like traps. And guess what? They start feeling like clinical puzzles. If nursing school feels difficult, you're not alone. Many excellent nurses once sat right where you are. They were overwhelmed. They were frustrated. They questioned themselves. They had difficulty. But that difficulty doesn't mean that you don't belong. Sometimes it means you're growing into the level of thinking that this profession requires. So if this episode encouraged you, subscribe to OB Clarity and share it with a classmate, because that classmate might need this also. This week, I want you to reflect on one area where struggle may be building your clinical strength. So in obstetrics and nursing, as I always say, always assess. Don't guess.